Hey everyone, how are you? Thank you so much for tuning in to this live presentation that is being hosted on LinkedIn and YouTube simultaneously. Really excited to be doing this live right now. I'm just getting my audio together. I'm Tiffany Robinson, and I am the owner and founder of Beyond RCM Revenue Cycle Management. And I'm really excited to present this live on our future in healthcare. So, thank you so much for joining me. If you're joining the live, shout out to you for tuning in 8 o'clock, after work with me on the live. If you're going to catch us on the replay, then thank you for tuning in. I want to be respectful of everyone's time. So my goal is to make this presentation 30 minutes and it's going to be impactful. And this presentation is geared towards individuals at different parts of their career. So whether you're trying to figure out what you want to do, we have a segment for young adults, high school graduates, trying to navigate what they want to do career-wise, or maybe they're not sure what they want to do career-wise. So I want to introduce you to the world of medical billing and coding. Maybe you are someone who recently entered this field and you're struggling to get your foot in the door. So I want to share with you a little bit about my personal experiences and how I navigated getting my foot in the door, etc. And then I want to challenge. I want to give a call to action for my seasoned professionals, because there is a lot of talk in the healthcare space about AI and artificial intelligence and how to leverage this technology in the healthcare space. I have been attending a lot of different webinars, workshops. I actually attended a leadership conference in Dallas a couple of weeks ago, and there was a lot of conversations about AI and people being fearful. So I'm going to give my thoughts on that, as someone who's been in this industry for about a minute, on how I feel about AI and how I'm approaching AI. So there's something in here for everyone. So I'm just going to adjust my screen a little bit. I'm going to move myself out of the frame so that the presentation is showing. So my disclaimer, don't come for me. My disclaimer is this presentation is based on my professional experience in the healthcare industry and is intended for informational purposes only. It does not constitute as legal advice. All information provided should be independently verified. The references cited in this presentation were vetted at the time of preparation and may be subject to change based on industry shifts outside of my control. So just wanted to get a little housekeeping out of the way before we delve into the topic. So I put the agenda up on LinkedIn and I believe other social media platforms. So we have 4 specific target areas that we're going to touch in tonight's live stream. We're going to talk about the healthcare industry boom, why this industry is booming, and healthcare is a great industry to consider. We're going to talk to recent high school grads and why they should consider kickstarting their career journey in medical billing and coding. We're going to provide tips for new medical billers and coders to help them break into the industry. And the final topic we're going to touch on is why seasoned professionals should not be afraid of AI. Do not be afraid of AI. And we're going to do this all by 8:30, okay? So let me tell you a little bit about little old Tiffany. Tiffany started in the healthcare industry in 1998. I was 17 years old. That's right, 17. When I finished high school, quite honestly, I had no intention of going to college. I was someone who kind of felt like college was not for me. It was not necessary. I think most young adults who spend 12 to 14 years going to school nonstop want that break. And I was definitely someone who wanted that break. I did not go to college until my mid-20s. And I will tell you, going into my 26th year into my career, I've obtained a couple college degrees, a couple certifications. And that 17-year-old who said she would never go to college and was done with school loves learning. So I love learning new things. So, we grow, we evolve, we change. Our opinion one day may not be our opinion another day, another year, another decade. I currently work full time for an amazing medical organization as their director of revenue cycle management. This organization they keep me on my toes because they are very cutting edge. They embrace technology. We're always seeing how we can be innovative and leverage technology to make the organization run more efficiently. So I absolutely love my day job. I sometimes feel like I sometimes feel like my boss thinks I'm Ethan Hunt and they send me out on like these Mission Impossible adventures, but we make it work and it keeps it exciting. And when I am not playing Ethan Hunt in Mission Impossible, I have Beyond RCM, which is my consulting company. I've had my consulting company since 2009. At Beyond RCM, I have worked with countless medical providers, medical organizations on various issues related to revenue cycle management. I also enjoy mentoring and coaching the next generation of healthcare professionals. So Beyond RCM is, really my passion project, and it's where I get to give back in the industry, and I really enjoy doing it. I love it. So I have a couple questions, and and my logo is in the background, so I want to apologize. But that photo that you see is a photo of the late great Bob Marley, and the caption says, "Only the fittest of the fittest shall survive." You can put in the comment if you know what song that is in reference to. But Robert Nesta Marley, also known as Bob Marley, has a song that says, "Only the fittest of the fittest shall survive." So I have a couple questions for you, keeping in the spirit of Bob Marley and that famous song. I want to ask you a couple questions. Are you excited or fearful? Because we are in the middle of a tech revolution, right? There's no way about it. We've had many iterations of revolutions here in the United States of America. We've had the Industrial Revolution. We're now in the midst of a tech revolution. And I want to know, ask yourself, are you excited or fearful of this tech revolution? Then I want you to ask yourself, if you're excited, are you embracing this era boldly or cautiously optimistic? Okay. If I'm being honest, I'm the latter. I am approaching this tech revolution from a cautiously optimistic perspective. And if many of you follow me on socials, on YouTube, you know how I feel about technology, right? But I'm not running from it, but I'm cautiously optimistic. If you are fearful of this technological revolution that we are in the midst of, are you ignoring this era altogether? Are you ignoring it? I remember when automated systems came into play. My grandmother refused to use automated systems when it came out. Like, she would not. She just ignored it altogether. Didn't mean that automated systems was going away, but she made up her mind that she wasn't dealing with it. So, are you excited or fearful? If you're excited, are you embracing this new technology or this new era boldly, cautiously optimistic, or are you ignoring it altogether? Okay. Let's talk about the healthcare industry boom. And it's important for us to ask ourselves this question because we are in the midst of a healthcare industry boom. Okay. For better or worse, the United States spends, as of 2022, and this data, I pulled this data from CMS, right? So the United States spends 17.3% of our gross domestic product, our GDP. So 17.3% as of 2022. I believe it's closer to 20 now. I was looking at a report on MSNBC, and one of the commentators said that it's closer to 20. But the statistics from CMS say that as of 2022, 17.3% of our GDP is on healthcare. Okay, that means that we spend a total of $4.5 trillion on healthcare annually, or that totals out to $13,493 per person. Okay, and I indicated the source. The source for that is CMS. According to the U.S. Bureau of Labor Statistics, overall employment in healthcare occupations, stumbling over myself, I'm so excited and I'm trying to get done on time. So according to the U.S. Bureau of Labor Statistics, the healthcare industry is expected to grow much faster on average for all occupations between the year 2022 and 2032. About 1.8 million openings are projected each year on average, okay? And this growth is due to a number of factors. We do know that we have an aging population. We have a larger aging population. And we have a lot of individuals who are transitioning out of the workforce. So we have individuals who are retiring. So, and that's doctors, nurses, midwives, physician assistants. So run the gamut. The healthcare industry is growing, it's booming. And with this boom, we are going to need more medical administrative workers. If we're going to have more doctors, more nurses, more nurse practitioners, more physician assistants, you name it, we are going to need more medical administrative positions. So this is one of the most secure industries that you could enter. If you're looking to figure out, where should I go? What should I do? Healthcare has great opportunity, and it shows no signs of slowing down. Okay. So now I want to talk to my young adults, right? Because we're in New York, and, we're in the middle of graduation season in New York. And, I know in other states, you guys have probably already completed your graduation season, like in states like Louisiana. Shout out to NOLA. I know that you guys have already probably had graduations, etc. But we have a lot of high school individuals who are finishing high school. And, it's kind of, everyone assumes that when individuals finish high school that they're automatically ready to transition into college right away, but that's not always the case. A lot of times some young adults, they're not ready for college. They may not know what they want to do, and they don't want to spend time going into college too soon without figuring out what they want to do. So while a lot of young adults transition from high school to college, there are a lot of young adults who are not certain yet. And what I want to say is, this is why a career path such as medical billing and coding, especially if you are interested in the medical field, if you like technology, things of that nature, computers, medical billing and coding might be something you want to consider. So if you're not ready for college, I just want to point out, you don't need a college degree to become a certified medical biller or coder. I just want to tell you a little bit about myself. I didn't go to college until I was 25. I finished high school at the age of 17, said, I don't need, hey Kinjal, how you doing? Thank you for checking in. And let me just give a little shout out. Hey Angela, hey Christy. I don't want y'all to feel like I don't see you either. But speaking for myself, when I finished high school at 17, as far as I was concerned, I was never going to college. I was done. I was tired. I was exhausted. And I stumbled into the field of medical billing and coding. I tell the story on my YouTube channel in earlier videos where I was pregnant with my now, hey Mish, I was pregnant with my now 25-year-old son. And I needed a career. I needed a way to, to help support my child. And back in the day, the Daily News, which was our local paper. I know that some of the younger people are like, what? Newspapers? But yeah, the Daily News was promoting medical billing and coding and talking about, oh, you could grow your career and you could work from home. And I was pregnant, about to have a baby, wanted to be able to support my child. And I stumbled into this field, right? And I haven't looked back since. So I started my career with just a high school diploma. Eventually, I did go back to college and complete my college degree, but I didn't need to start my career with a college degree. So I just want to encourage young adults, if you're not sure yet what you want to do, what you want your career path to be, this is a career opportunity that does not require you to go to college, and you might want to consider becoming a certified medical biller and coder. And there are a lot of certification programs out there to help you, get the fundamentals of medical billing and coding. And it's a great way for you to enter the workforce. And there is tremendous growth opportunities. 26 years later, I am a director of Revenue Cycle Management. I get to work on amazing, fascinating projects in my day job. I get to collaborate with organizations outside of my day job. And that all started with a high school diploma and a certificate in medical billing and coding. So it's a great way to jumpstart your career if you're not sure what you want to do. So parents, if you have a young adult who's not sure which way they want to go, have them look at this video. If they're into the medical field, if they're into computers, have them watch this video, have them do some research, because this could be a great opportunity for them to at least, start their career and then kind of figure it out from there. So now I want to shift gears a little bit, right? And I want to talk about breaking into the industry. How bad? How bad do you want it? How bad? How bad do you want it? So when I became certified, and let me give you this disclaimer, okay? Because I get a lot of DMs from individuals saying, hey, can you get me a job? And I'm not a headhunter. She is not a recruiter. She is not a talent acquisition specialist. She's just someone that loves what she does. And anytime I hear of an organization hiring, I always want to share it with individuals because I know a lot of people are looking for jobs. So if you have DM'd me thinking that I am your personal headhunter, you probably got a reply where I said, hey, yeah, I don't do that, but best of luck to you. Now, if I am ever hiring or my organization is ever hiring, I also post that. I've been able to recruit some really great talent from LinkedIn when my organization was hiring. But obviously, we can't hire everyone. So if I ever have a career opportunity, I am the first one to share it. But she is not your personal headhunter. So that's just my disclaimer. Okay. With that being said, I want to talk about breaking into the industry because when I started my career, I had a very difficult time breaking into the industry. Number one, I was about 7 months pregnant and wasn't nobody trying to hire me at 7 months pregnant. The other problem that I ran into, even before, you could visibly see that I was about to have a baby, was that I kept getting a lot of individuals saying that, oh, we really like you, but you don't have enough experience, and I kept hearing that over and over again. So I'm saying all that to say, I know what it's like to start out. I know what it's like to have a hard time breaking into the industry. I know what it's like to be frustrated and say, well, how am I ever going to get my start if no one gives me a chance? I have been there. And I want to encourage you. You have to be, if you are really serious about breaking into this industry, you're going to have to think outside the box, right? So what I did when I started my career was when I saw, look, no one's going to hire me at this point, like my belly's out to here, no one's hiring me. I decided to sign up at a local hospital to do an internship. I went in, I said, I'd like to volunteer. Do you have any opportunities? I told them, preferably I'd like to work in an area or, volunteer in an area where I can, work with medical records, documentation, etc. And they put me in the OBGYN department, ironically. They put me in the OBGYN department to intern. And I was the best little old intern that you ever did see. Okay. Shout out to SUNY Downstate that gave me that opportunity in 1998. What happened was after I gave birth to my son, SUNY Downstate, I made such a great impression. I showed up on time. I went above and beyond when they asked me to handle different tasks. They were so impressed with me that they offered me a job once I had my son and was finished with my maternity leave. So that hospital that I started interning at actually ended up hiring me, and that's how I got my foot in the door. I had to be creative. I had to figure out what other angle can I take to get my foot in the door and show people if they give me a chance that I'm gonna step up to the plate and I'm not gonna let them down. So I'm saying all that to say, yes, you may have gone to school to become a certified medical biller or medical coder. Yes, you may have scored extremely well on your exams. It doesn't necessarily mean that you're going to get your dream job right away. It doesn't mean that individuals are just going to roll out the red carpet and say, hey, you did great. Let's just, give you this job. Oftentimes, you're going to have to be creative. So I want to give you 3 different areas that you can consider starting out at. You can consider starting out being an insurance verification specialist. Many larger organizations have positions for insurance verification specialists because even though the insurance portals will give you information, sometimes you need to know specific benefits. Certain practices perform certain procedures, and you have to be very meticulous about checking the benefits of those services before clearing those patients. So an insurance verification specialist is a great way for you to get your foot in the door. So you may be a certified medical biller, you may be a certified medical coder, but you might be having a hard time landing your first job. Consider areas where they're not going to be as stringent on the experience level with the intention of, I'm going to get my foot in the door. I'm going to get some experience under my belt, and then I'm going to parlay this into the area that I really want to work in. Another great area that you may want to look at is the prior authorization process. Remember what I said, certain practices have very specific services that they perform. And a lot of times those services, especially if they're surgical procedures, require prior authorization. And when you're dealing with prior authorization, oftentimes you have to send clinical information, you have to send supporting documentation, you have to follow up with the insurance company before the procedure will get approved. And and medical facilities need individuals to complete this. So again, this is a great way to get your foot in the door. Another area that you want to consider is medical collections. Collections, collections is vital. Okay. Collections is essentially once you get your bill out the door, stalking the insurance company and saying, "Where's my money?" Just joking. I like to joke to just break up the monotony of what we're talking about. But collections essentially is making sure that medical practices get paid for their services, following up with the insurance companies, making sure that if claims are getting denied, that you are resolving those claims issues and getting it back out the door. So, and a lot of times organizations need good medical collectors. And being a medical collector, you will find an employer will give you an opportunity with less experience. And the great thing about feel like areas like prior authorization and medical collections is you get exposed to a lot of the coding and a lot of the billing practices, and it actually helps you gain better insight into the field and what you're supposed to do. So I want you to consider, if you're having a hard time getting into the industry and you're certified, I want you to consider, what are the other areas that I can apply to that will allow me to get my foot in the door so I can get the experience on my resume to then transition. When I started out at Downstate, I was hired as a clerical specialist. I wasn't trying to be no clerical specialist after I went to school for billing, but that's the position that I took to get my foot in the door. I stayed there for 2 years. And then after 2 years, I was finally able to transition into a medical billing position. So I'm not just saying this because it sounds good. I'm saying this because I actually live this and I can relate to it. And I just want to say that Beyond RCM, we recently launched mini programs. So like I said, I've taken a lot of certifications. I've done a couple of degrees. So I have a pretty good pulse on what is inside most of these curriculums. And what we are doing at Beyond RCM is we have launched a teachable platform where we are releasing teachable lessons every month at a very cost-effective price, where we will give you a deep dive into these different areas. So our first lesson launched this month, which is insurance verification. We give you an in-depth understanding of the insurance verification process. It's not log in, put in the member ID, date of birth, and no. We break it down and we explain. We explain the purpose of insurance verification, the fundamentals of insurance verification, the concepts of key components in the verification process, how to leverage technology to do verifications correctly, and best practices. So if you are interested in getting a deep dive into these different areas, I definitely want you to check out our website, www.beyondrcm.com. We're going to be putting out cost-effective lessons, one lesson per month for the next 12 months. And we're going to be touching on topics that specifically a lot of the colleges do not spend enough time deep diving into, and a lot of the billing and coding certification programs do not spend a lot of time deep diving into. So I'm really, really excited about that. So next, and I'm going to take myself off of the screen so you can see my next. So now we're going to get into the age of artificial intelligence. Ooh. So everyone is talking about AI. Like AI is all the rage. It's artificial, it's AI, it's this, it's tech, it's going to get rid of all of us. AI, yay. So AI is a hot topic in many industries. And honestly, AI has been in various parts of different industries for quite some time. It is just being accelerated at the moment because, you know. So I want to talk a little bit about the emergence of AI and how we can benefit in this space. So the emergence of AI really shows extraordinary potential in various areas. We're talking about in the treatment of diseases, such as cancer. We're talking about complex drug manufacturing, genomics, medical research, and clinical trials. AI is showing a lot of promising potential in all these different areas. When we talk about clinical trials, there's actually types of artificial intelligence that can run different patterns of gene types to help develop cancer treatments for patients. So there's and the same is done with medications. So there's a lot of good. There's a lot of good that's being done with AI that's accelerating science in a way that we haven't seen in quite a long time, right? And with the emergence of AI in these different areas, obviously it's going to be filtered into other parts of the workforce, such as medical billing and coding, right? So I want to talk to my seasoned professionals because what I find is I started in this field in an era where we build a lot on paper, and it was a big deal if you were sending your claims electronically. Like if you were sending your claims electronically when I started, you were cutting edge, right? And what I have found is individuals who have been in the industry as long as I have, with all of this talk of AI, they are very nervous. They are very nervous. They are not wanting to embrace this technology. I'm hearing a lot of they're going to replace us. And I just want to say, we said the same thing about the internet in the 90s. We said the same thing about electronic medical records when it got introduced. We said the same thing about ICD-10. We always felt like we were not prepared, we were not ready, and we survived. We survived. Here we are, 2024. I'm live streaming on LinkedIn. I'm a dial-up America Online buffering. You got mail, kid. So we survived, and we will survive this technological renaissance of AI as well. What I am concerned about with many of my colleagues is the reluctance to really learn this technology and dip your toe in just a little bit. It is not helping us on the practice side, right? On the medical provider side. Because if we're reluctant to embrace technology for fear that it's going to replace us or for fear that we won't be needed anymore, then someone in the industry is going to utilize this information. And the someone is likely going to be the insurance companies. So I just want to say, it is called artificial intelligence for a reason. It does not have a soul. It can assist you, but you are still the orchestrator, the conductor of this technology. So the key becomes, how do you utilize this technology in a way where you send something out in writing and somebody don't say, well, Chat GPT wrote this, you didn't have any creative input in this. How do you leverage this technology in a way where you use it and you guide how the technology is utilized? And I want to encourage individuals who are afraid of AI, just dip your toe in the pond just a little bit, especially if you are working in healthcare administration, because I guarantee you that the insurance companies, and my position with insurances, we have to deal with insurances, but I'm a provider advocate. I'm not an insurance advocate. So if I sound biased, it's because I probably am. The insurance companies will use this technology to make our lives as medical billers and coders more difficult. Remember when I said EMRs, when EMRs were being promoted by vendors like a decade ago, they kept talking about how great it was going to be. You don't need paper charts anymore. It's going to be able to code for you. It's going to be able to do all these great things. And I can't tell you how many providers I worked with that said, oh, you're not even going to need a biller anymore. And here we are 10 years plus into it, and they're dealing with all of these SIU audits, this medical record audit, this chart audit. Why? Why are we seeing these increases in audits and requests and, inevitably our workflows, because we have to meet these requests? It's because these insurance companies are using the data from these systems to run data analytics, to run algorithms, to do more chart reviews, to do more targeted analysis. So the reality is, and you are in the office not embracing technology feeling like, well, I'm inundated because I keep getting all these chart reviews. The reality is they are using this technology to delay reimbursement in many instances or provide barriers to reimbursement. So it behooves us as provider advocates to stay on top of this technology and learn as much of it as possible so that we could be assets to the organizations that we work for. I cannot tell you how many practices I have consulted with in the past decade that are literally their practices are dying because they will not embrace technology. We are in a new era. Long gone are the days of dropping your claims on paper and just getting a check. You many times you're going to have to send clinical documentation. You're going to have to make sure that your services meet medical necessity. You're going to have to make sure your coding is on point. Long gone are the days where a doctor can just scribble on a progress note. You're going to have to make sure that when you print out those records that they can see the picture of the patient being seen. So I want to encourage my seasoned professionals, please don't be afraid of AI. We need to be managing this technology because the insurance companies are managing this technology. And I also want to say, our government is very behind the 8 ball on regulating AI. Like when Elon Musk is telling us that he's scared, we in trouble, y'all. So our government is behind the ball on regulating AI, and we need advocates, provider advocates, managing how AI is utilized in the healthcare space. We cannot leave that up to the big insurance companies and the lobbyists for insurance companies to have all of the dialogue with our government officials. We need providers, provider advocates, healthcare administrative advocates to be having these discussions as well, because at the end of the day, if we allow insurance companies to lead the charge in regulating AI, they are gonna leverage it in a way that benefits them. Okay, because at the end of the day, most insurance companies are capitalists who care a lot about patient care. And I'm gonna leave it there. If you know, you know. And the last thing I want to add is young people. Y'all love technology. So this is a great time. Once again, yes, I'm doing a shameless plug to young people. This is an opportunity for you to get into the healthcare industry because we are doing so many cool things with AI right now. And y'all love technology. Y'all always doing new things in technology. So this is a great space for you to consider because you'll get to exercise some of those tech muscles in a meaningful way. So that's my sales pitch. Don't be afraid of AI. Let us embrace it. We survived many iterations of tech, and we will survive this one as well. I know I'm a little over schedule, so this is, I'm wrapping up. These are my last 2 slides. So final thoughts. If you guys have been watching my channel on YouTube, at Beyond RCM, or you've been checking out some of my videos on LinkedIn, I have a lot of feelings about this Change Healthcare cyber attack and what has gone down. Honestly, I feel like they are not getting enough attention for this epic disaster that occurred. Okay. And what it exposed how unprepared the owners of Change Healthcare were for this cyber attack. I mean, even now we are still dealing with the fallout. There are a couple insurance companies that we can't even get them to answer the phone because they still waiting for Change Healthcare to tell them what to do. Okay. It's a big deal what happened. And if you don't know, Change Healthcare was the victim of a cyber attack. A couple bad actors hijacked their platform and they had to pay allegedly millions of dollars in cryptocurrency to get the data released. And what's really disappointing to me is the company involved is a company that goes out of their way to request charts for everything because they want to control healthcare costs and they want to manage the quality of care. And here they go getting their whole database hijacked. That's a discussion in and of itself. But what the Change Healthcare cyber attack showed me as someone who has been in this industry as long as I have been in this industry, it showed me how we have become so reliant on technology that we don't default to the backup plan. You ever see the commercials where people say have a backup plan in place? Be prepared for a disaster, like have water and food, and the same concept applies in this industry. Although we are using technology in a way that is innovative and reduces time, like when stuff goes left, you got to know how to default to old school, okay? And that means dropping those claims to paper and getting them out the door. That means going directly to your insurance portals or calling the automated systems to check claim status. And what I found was there were so many organizations that just didn't know how to navigate this cyber attack because we got so used to relying on technology. So, as much as I am an advocate for technology and tech making our lives easier, you have to have a what if something goes like left, what are we going to do? And I do understand that a lot of individuals who may have entered this field where they didn't do a lot of billing on paper, or they don't know what it's like to have a dot matrix and writing the insurance claims address on an envelope and shipping it out. But for some of us seasoned professionals, we know what that's like, and that's why our experience is so meaningful in this space. We should be leading the charge of embracing tech, but we should also be there to support individuals in this field who may not have had to do things in a more manual way. And if nothing showed us the importance of knowing how to do both, knowing how to walk and chew gum at the same time, the Change Healthcare cyber attack should awaken us to the fact that you have to have a backup plan in place. Okay. I also want to say in my final thought that healthcare administrative jobs are always going to be in demand. And we need a holistic understanding of this system in order to be agile, okay, in times of disruption. So being agile means that you're not going to rely on technology when things start acting up. You're going to know how to default to a manual process. And I want to say, if you just graduated high school and are not sure what you want to do yet, relax. There are many career options that you can pursue that don't require a college degree. And my last thought is, I want to say your career journey is in your hands, right? Yes, it's hard when you get your start in the field. Yes, you may be getting, a lot of no's and you may feel like I want to give up, but your career destiny is in your hands. I want, if you're serious about being in this industry, I want you to not quit. I told you a little bit about my journey. I told you a little bit about all the doors that got slammed in my face. I told you I started this career at the age of 17 with a high school diploma and a baby on the way. And 25, going into my 26th year, I could not have imagined having the career that I have. I wake up every day and I'm challenged. I am learning. I get to work with younger people that force me to get out of my comfort zone and embrace things that I may not have necessarily thought I wanted to embrace that day, but I haven't regretted it. And if I would have given up, and trust me, there were times starting out when I heard so many no's that I contemplated doing something that would just give me a job. But if I would have given up, I wouldn't be here tonight on this live 26 years almost later, encouraging you. So I just want to say, if you're having a hard time, please do not give up. Hang in there. Be creative. Think outside the box. Remember my earlier slide, my quote from Bob Marley: only the fittest of the fittest shall survive. So I want to thank you guys for hanging out with me. I went over by 8 minutes. I tried. My heart was in the right place. I hope you guys enjoyed it. I will put my contact information. Give me 1 second. I'll put my contact information up. If you guys are on LinkedIn, you already know how to find me. If you would like to email me, my email is info@beyondrcm.com. Again, if you are interested in utilizing any of our master classes, you can find that information on our website, www.beyondrcm.com. Thank you so much for hanging out with me tonight. I am Tiffany Robinson, and I am signing off. God bless.